Hello, everyone, and welcome to this Facebook and Twitter Live. We are live on PAHO Caribbean and on PAHO Twitter, and we're so pleased that you will join us today. My name is Lisa Bailey, and today we're going to be talking about protecting populations in vulnerable situations in the context of COVID-19. And I have two guests, and they are going to be talking with us about this very important topic today. Now, I'm sure you know, since early 2020, the world has been in the throes of an unprecedented pandemic caused by COVID-19. And the response has required the implementation of public health measures. How and to what extent they've been implemented vary between countries. But what we do know is that these measures have had a greater impact on certain social groups and territories, exposing pre-existing social, economic, and health inequalities and exacerbating them. Now, in response, countries have adopted preventative non-pharmacological measures, including home confinement, schools and businesses have closed. But for these measures to be effective, everyone must be able to comply with them. But this is not always the case. And this is the subject of a new guide from the Pan American Health Organization, and that's what we'll be discussing today. I have with me Dr. Jerry Ekmans, Chief of the Health Promotion and Social Determinants Unit at PAHO. And we also have a special guest today from the Caribbean Public Health Agency, Dr. Joy St. John. Welcome, ladies. How are you both doing today?
Thank you. Thank you so much, Lisa. Hi, Joy. Hi, friends on Facebook. It's a pleasure to be here. Thank you.
Great. I'm so glad that you could join us today for this very important discussion. Before we discuss the guide, I mean, we've all had quite a year, right? How has COVID-19 affected both of your lives? Let's start with our special guest, Dr. St. John. How has COVID affected you?
Well, thank you so much for this opportunity to discuss this really important topic. And COVID-19 has stranded me in the country of my birth. Normally, I would be working in Trinidad at the headquarters of the Caribbean Public Health Agency. But in March, I came for a visit, and then Trinidad closed its borders, and they haven't reopened as yet. But apart from that, my life hasn't really changed that much. And I am enjoying the ability to reach many people and go many places with the messages about COVID-19 through the virtual medium.
And what about you, Dr. Jerry?
Yes, well, I'm here in Washington, D.C. I came back from Brazil just at the time the borders were closing for European people from Europe. And since then I've been here at home working with my teams in different locations. And so, yes, it's been a very different time. Normally, we do quite a bit of technical cooperation. We travel to the country, so that's been different. But as Joy says, it has also opened new opportunities. So we're in each other's homes now, and we can connect in ways that we wouldn't have thought possible probably in January. So interesting times.
Definitely, definitely. Well, we're talking about risks and vulnerabilities. What do you think makes someone vulnerable, and how would you like to be protected? Jerry.
Well, so when COVID started, we saw that the measures that were being recommended, implemented in the different countries, stay at home, close non-essential businesses, closing schools, we saw that this had a disproportionate impact on some of the populations. And particularly what we call those populations in situations of vulnerability. Normally we have the tendency to talk about vulnerable populations. We say those with disabilities, indigenous populations, Afro-descendant populations, which of course they have a higher risk very often on getting COVID, etc. But the vulnerability related to the implementation of the public health measures have been different. So we see new groups of vulnerable people. They were there before, but now they're more visible. and their situation has become worse. So that has worried us, and that's what led us to look at really specifically what does vulnerability mean in the face of COVID.
And for you, Dr. St. John, what would you say has made people feel vulnerable in the Caribbean as it relates to COVID-19?
I'll tell you what's made me feel vulnerable. The fact that this is a disease that I don't really know anything about. And it's supposed to attack people like me, older people with underlying conditions. And what has also made me feel vulnerable emotionally is, in order to be safe, I have been cut off from a lot of the activities and a lot of the people that I would normally have interacted with. So there is physical vulnerability and there is emotional vulnerability. And I can only imagine what it is like for those who have not been able to feel empowered, have not been able to earn their own livelihoods, who have not been able to be sure that an activity that was necessary for them to function is no longer accessible to them. And I think COVID-19 is showing us some of the ways in which we have to rethink how we interact with people and how we view people.
It's interesting because I think we talk a lot about risk, but I don't think we really talk that much about vulnerabilities. So before we go more into that, Jerry, maybe you can tell us a bit about the guide, what made you all do it and who was involved in its production.
Yeah, thank you. So as you know, when early on in March, when COVID reached this region, and even before that, the Pan American Health Organization had set up this incident management team. And these are the people that work with the countries on the function of hospitals, on testing, on surveillance, all those very important issues. But we saw, and the direction of PAHO saw that we also needed to look at some other things. And so that's why it was decided to set up a working group with people from all over PAHO. And I had the fortune to lead that group and to look at what does this mean now? How does vulnerability how is it generated, and how are those vulnerable populations, the populations in situations of vulnerability affected, and what needs to be done about that? So that's how this guide was developed. We did a very deep research. We have more than 1,600 articles from this region and from this region, from the Americas, and also some from other parts of the world that look at the implementation of the public health measures and how certain groups are being affected and what's been done about it. So it's been a very deep dive, and that's where we are. We did it.
Very well done. I wasn't able to read the whole thing, but I did read a lot of it, and it's a lot done in a very short space of time. Who is the guide intended for?
It's a guide for national governments, for ministries of health, but also it really appeals to intersectoral action. So it's not something that a Ministry of Health can do alone. So they can also need to work with other ministries. So it's also useful for them, and also local level governments. It is very much geared towards governments, but of course there are other agencies who can also use this guide.
Well, remember that you can ask your questions as well. Please feel free to put your questions in the chat. We are here to discuss this topic with you. It's not just us sitting here talking together, although we're enjoying this conversation. You too can be a part of the conversation. Now, what were some of the main recommendations that came out of this guide? And Dr. St. John, you can feel free to jump in as well, because I know you've read the guide and you are very happy because you are all about determinants of health and looking at all of the different the aspects that play into how we protect people's health. What are some of the main recommendations that came out of it, Dr. Ickenant? And maybe Dr. St. John, you can comment after on why this is also important.
Yeah, thank you. I would say there are a couple of overarching recommendations that have to do with when you implement your public health measures, make sure that you know your people, make sure that you know the conditions, the context, and make sure that you adjust it to that context. I'm going to give you just one small example. When we say wash your hands with water and soap, I mean, what does this mean for somebody who does not have access 24 hours a day to running water? And this can be for different reasons, because they couldn't pay the bill, or because the piping simply doesn't come to their homes, or for many other reasons. So when you implement that measure, make sure that people really can comply with it. So that's one thing. Then you need to know which are those people that are most vulnerable. You need to know what are their barriers, what are their obstacles, and what are the consequences that could come from telling people to stay at home if they need to go out for work or make their living. So all those things, and then we looked at all that and say, okay, now these are the recommendations that need to be taken, and we can talk a little bit more about that further. I would like to hear from Joy how she has approached it and how she's been looking at that.
But first of all, I want to talk about this whole thing about determinants of health, because a lot of people think you're sick, a doctor deals with it. They think on that very personal interface, doctor-patient. But in public health, we look at population level. We look at all of the things that affect health. And when you look at it from that perspective, a lot of what makes us well or sick is not under the control of the Ministry of Health or even sometimes the government. There are so many determinants of health, the causes of the causes, which lie in other sectors, which are environmental. And so I loved the treatment of COVID-19 from that perspective in this guide, because it's one of the most practical, understandable ways of looking at life. And I think the guide also may be used not just by governments, but it may be good for sectors outside of health to look at and understand how what they do, the decisions they make to progress their sector, can affect health. And so when we're looking at COVID-19, we have to say to ourselves, it's time that we relook the world order. We relook how we relate to the different groups in society. And we have to decide what is going to be important for each sector going forward. Are we going to be looking at things through the health perspective, as we're looking now with our protocols to return to safe work, safe interaction with other persons in society? All of those things, I think it's time we start asking those hard questions.
Definitely. I mean, we've come a long way from, you have a problem, you put out one message, and we expect everybody to be able to do what we say. I think we've realized that just doesn't work. It doesn't make sense. And certainly COVID-19 has shown us that for sure. I want to stay with you for a little bit, Dr. St. John, in terms of the vulnerabilities in the Caribbean. Who is now considered vulnerable as it relates to COVID-19? And I want us to widen the lens a little bit outside of just, as you said, health, not just persons with NCDs. Who is vulnerable in the Caribbean as it relates to COVID-19?
I'm ahead of you, Lisa.
I expect you to be.
The vulnerabilities when it comes to COVID-19 were originally couched in terms of older persons, persons with NCDs. But I remember early on, we were looking at the ordering of personal protective equipment. And I was asked, what are these numbers going to be? What is it like? Who should get? And I said, well, if you were talking about who is vulnerable, let's start talking about the security sector. Let's start talking about the service industries. the persons who serve us in the supermarkets, the persons who deliver our food, the persons who clean our buildings. Let's start looking at them when we're talking about the PPE needs. And a lot of the time, the people who are most important to us to make our lives run smoothly are not necessarily the people who are valued in society. And I think that it's going to be important for that flip of the switch in going forward and in reshaping our lives, because believe it or not, even with vaccine, we have to continue ways of living that are different if we're going to survive.
Indeed, for sure. Definitely those in the service industry are definitely on the front line. The frontline workers have changed in COVID-19 for sure. Dr. Jerry Ickmans, why is it important to identify these populations? What happens if we continue to do things as we used to?
This is an essential question. What we've seen in this region, this region has been the epicenter since early on of the epidemic, and still is very much at the heart. There are a couple of countries in this region really drive the epidemic, and but most countries have had real difficult times to control this. Now, one of the things we saw, particularly in South America, is that because there's a lot of informal workers, so people who do not have an employer, who do not have social protection. So those people, for them, it was very difficult to stay at home. So if you don't identify them and don't make sure that they get their bonuses, their food, they're integrated in social protection programs, your messages and your measures become very ineffective. And we all know that in order to have effective public health interventions, they have to be applicable and usable by everybody. And so if you have a large group of people who falls out of the boat, let's say, who cannot do that for different reasons, you become really, as a whole society, you will have problems in controlling not only COVID, but also in controlling all those side effects that we are talking about. So you only started to look at the essential workers you have been talking about. You need to understand where they are, who they are. If they go out and work and come back home in their crowded house with 2 households or with an extended family, where you have people maybe, the elderly and people with underlying conditions, how are they going to self-isolate if they need to? So these are, it's important to understand those vulnerabilities. When you look at people living in a situation where there is an aggressor in the family and you tell them to stay home for 9 months, well, you can just, and we've seen, that the violence has come up everywhere in the world, domestic violence. And so these are issues that if you don't know where those vulnerabilities are, where those vulnerable populations are, you will not be able to address and to implement the measures in the way they should be implemented. And you will create a whole lot of secondary, non-intended consequences. So that's why it's so important.
Agreed. Just before I went to sleep last night, because I tend to read before I go to sleep, and I was reading an article. I mean, we had a conversation yesterday before doing this live, and the article was about South America and many couples who have broken up during this, and the story was COVID-19 caused my divorce. And I said, wow, this is not something that I don't think anybody expected. And we're just seeing it. How do we respond to these things? And do we learn from this pandemic? Do we do things differently the next time? It's almost as though COVID has pulled back the wool. So all of these things existed before, and COVID just blew up a lot of things. And Dr. St. John, if you wanted to comment, I see you shaking your head. If you wanted to comment, feel free.
We have been accustomed to a way of living that separated families for a good portion of the day. And when they wanted to relax after work, they could relax and then come home. And that was taken away. And the violence has not just been physical or sexual, there's been a lot of mental abuse. The way in which people talk to each other, they don't talk to, they talk at, or they shout at. And the dynamic of the family has changed. Now, I am a prime example of a person who was normally away from home most of the time. And now I'm here 24/7. I hardly get out because my workload is that much. And I had to learn new ways of interacting and finding ways to separate from each of the members of my family, including the dog, so that when we came together again, it was nice, and it wasn't that it was, oh, they're not that person again. And I don't know how many people thought that this would be an issue. There are a lot of, as you said before, things that were mitigated by our ability to be apart, or our ability to relax in ways other than being in a particular building, that have now come up. So I'm glad that you're saying COVID caused my divorce. COVID caused me to think about the things that weren't working in my marriage. That's what happened.
True, very true. Now, so whose job is it? And I think we kind of said this already. This is not a health problem. We're in a pandemic, which is caused by a health problem, but this is no longer a health problem. So whose job is it to protect the community? Any of you?
So let me take a stab at that first.
Mm-hmm.
And I talked about the public health, people who look at populations. We have a big role. And our role is not just for clinical issues. And in fact, in CARFA, we've been doing a lot of work with other sectors. But this is also an all of society thing. And I'm really proud of the way that the heads of government in the CARICOM sub-region of the Americas have said to all sectors, everyone has to get on board first. The second thing that they have said is that in designing the way that we get back to normal living, we have to put everything around health. What allows us to do our activities without putting other people in harm's way or at risk, or making them more vulnerable? So there is a role for public health, and public health is also from the Ministry of Health perspective, not just the region of CARICOM or PAHO, the region of the Americas, but also there is the need for the governments, the governance structures, because CARICOM is a governance structure, the CARICOM Secretariat and the CARICOM institutions like CARFA. There's a need for a governance structure to allow that all of society approach, that re-engineering.
Dr. Eckermans?
Yeah, thank you. Totally. I think when a government needs to implement public health measures, which all a government had to do, and they know this can generate negative effects, then there is obviously a responsibility there for a government to address that. And I think this is why, you know, we target the guide mainly to national and local governments. Now, having said that, of course, the Ministry of Health alone, as Joy also explains, is not going to be able to do this. But health does have a role of advocacy towards other sectors, and you know, bringing this whole health and all policy concept of how the work of other sectors, education, labor, social protection, etc., is important for the health of people. So that is really that's really very important to look at that. So the kind of measures that we're needing, like expanding our social protection, no? Social security, etc., expanding our health insurances, you know, to make sure that people can go to the services they need, ensuring that the services do not discriminate, ensuring that those services are accessible, because it's not just having the social security card in your pocket. It's also, can you spare time to go? How long are the waiting times? How are you being treated, etc. So all those things are part of that need to be addressed when you move into this. What kind of employment do we have? Is our minimum wage enough to survive? And then even further, if you lose your job, do you have an income? Who is going to help you with that? So those responsibilities, they need to be put where they belong, which is at government levels. But of course, you need to work this with the entire society to make it workable. And maybe one point there on the community, they are the ones who know what's possible and what's not possible. So when you implement those measures, it's very wise to sit around the table with the communities in a safe way to say, okay, what's possible here? What else do you need in order to make it work in your neighborhood, in your village, in your community? So it's a lot of challenges for a lot of people.
I know.
Let me push a boundary outside of the region of the Americas. Mm-hmm. And let's talk about the fact that this is a virus that moves as people move. It's not just going to be about the Americas. It's going to be about the whole world. So in the same way that I spoke of CARICOM and the governance, there are global governance mechanisms that have to look at tourism, how to make that safe, that are going to look at migration, because the Caribbean has seen migration into our borders because we're perceived, rightly so, as safe. So how are we looking at that whole global governance and that whole movement of people for pleasure, for business, for migration? And I know that there has been a lot of nationalism during this COVID time. But there has to come a point where, as a world, we address this. This has started with COVAX, looking at how vaccine can be made available to all. It has also been part of how the WHO Global Solidarity clinical trials were executed. But there are many other ways in which we need to look at what will get the world out of this rather than what will get my country safe or what will get my country's economy back together again.
Yeah, I mean, I was going to ask you about migration, Dr. Aikemans, and if that was a part of the study as well, and if you wanted to expand on that, if you wanted to tackle that one first, but then I also wanted to talk a bit about that global shift and how do we, I would expect that once we launch this, maybe that's where the conversation can go, can start. So maybe we can talk a bit about migration in the region of the Americas and what the guide has found in that area.
The migration is one of the things that worries us a lot. Not necessarily migration, but the situation of the migrants. So this has been, when you talk about vulnerability, these were people who pre-COVID were already in a very difficult situation, unemployment, and in terms of housing, and in terms of income, you name it. So then COVID comes, and they are then the first ones to be pushed even further into problems. And this is something extremely important. We haven't talked a lot about inequalities and inequities, but we know that this region, the region of the Americas, is the most unequal and inequitable region in the world. So that shows, and then if you look at that whole spectrum, then the migrants come very much at the bottom end for everything. And Joy just brought up the point of the vaccine, if you think about how the vaccine will be distributed between countries, but also within the country, what other criteria that are going to be used there? Is equity one of them? And when we say the most vulnerable, are we going to, of course, we're going to look at the ones with the higher risks of dying. That's what we have been confusing a little bit, but the vulnerability and the risk. And so if we do that, when will a migrant ever get a vaccine? Under whose scheme will he or she fall? So these are things that are extremely important. So this is definitely one of the groups that comes out very strongly in our document, and there's some recommendations around that.
Dr. St. John, did you want to talk a bit about migration and CARFA, their experience in that area? Is that something that is being discussed at your level as well?
We have been aware that migrants are perhaps not always receiving the level of health care because they may not have the access. We are also aware that migrants are in the informal sector, which interacts a lot with the citizens of the CARICOM region. When God invented street food in the Caribbean, he also invented a love and the taste for food from all regions. And so some of the migrants are in the informal sector that people will visit for food. So we need to be aware, and when I say we, I mean the governments as well. We need to be aware that our citizens are interacting with the migrants on a daily basis and allow that access. CARFA hasn't been looking at it as a specific issue, but we are aware of the level of migration in the region. It's a lot more than people think. And we have persons coming into the region from outside of the region of the Americas. When I say the region, they're coming into CARICOM from outside of the region of the Americas as well. So the acknowledgement of what is happening in your society requires an acknowledgement not just of your citizens.
Agreed. Now remember, you can ask your questions as well. We are live on Facebook on PAHO Caribbean and also on Twitter, and we welcome your questions as well. We know this is not a topic that, is not really often discussed, and that's why this guide was written. I know it will be launched soon. We'll talk about that in a minute. But ladies, I want to ask you, what do you think should be next? So after the launch, does this open up this discussion, and hopefully we can start to talk about vulnerability and the fact that we need to talk about exclusion and inequities? And where does that conversation happen? Where should that conversation happen?
The words need to leap off the pages of the guide, and they need to be words that are discussed in the household, in the community, and also at the table when the policymakers and the program developers are deciding on how things will change. One thing about COVID-19, I always say that there's always a silver lining. One thing about COVID-19 is that it's bringing different sectors together to plan. And one of the other things that is going to be important for public health practitioners, especially those like Jerry, who live in the realm of social determinants of health, is that we have to find a language that allows different sectors to really work effectively together. So I want the words to leap off the page. And I want us also to try to think of ways in which we can bring the science to the recommendations for those changes. So I was really excited when Jerry said she had all of these different articles and publications that allowed her to analyze the situation. And perhaps in the CARICOM region, we need to do some of our own research So we have the science to back up the recommendations for change.
Dr. Ickermit?
Yes, totally. I think that the discussion is out there. We did not have discussions like this so much before COVID. I think even policymakers or even people who really didn't think those inequalities were a problem, you know, they were just there, and now see that, whoa, this is not only a problem for those people, but also for the society as a whole, because we can get COVID under control. And I think this is one of the things, first things, the discussion is out there. So, and I totally agree with Joy. This is also an opportunity of saying, look, you are now working in intersectoral way. How can we maintain this? How can we create a society where not only when there's a crisis, we're going to talk to each other and sit around the table, but we maintain this, and together we build a society that's safer, more inclusive, healthier, etc. for everybody, leaving no one behind. So that's one thing. And then the second thing I really think needs to happen and is the action. You know, this guide is it's called a guide for a reason. We had a lot of discussions how this was going to be called, but it's really about, unfortunately, we're not out of COVID yet. Even if the vaccine is, on the horizon, a few vaccines, we are still going to live with COVID for a while. And in that period, we're seeing governments closing again. California just announced a very strict closing just today. And this is going to be happening in the countries. When you open back up with tourism, it's great, it's necessary, but it will also have some, it could again be seen in Curacao, boom, the cases fly up again. So these are the things we will need to work on, the implementation of those measures for a while more. And there is fatigue, there is a lot of things, but we also need to then look at what are those recommendations that are out there and how can we implement them at the same time as we control the COVID, also to control the collateral damage that we're doing by those with those measures.
I think we know that everything is connected, but I think we try to simplify life. So perhaps that's why we focus on the public health system. And what I think I've taken away from this is that we're not just talking about a public health system here. We're talking about a social protection. And to me, the safety net has to change. It has to include different people. What do you think, Dr. St. John?
I'm going to throw up something else. Universal health coverage. And that implies health measures, it implies access to those health measures. It discusses the funding of health programs. But we have to now do, because of COVID, universal health coverage with a twist. And the twist is the involvement of all of the sectors. And what is it about the sectoral re-engineering that is going to minimize the risk of a pandemic again, of a COVID virus coming up again? And the Sustainable Development Goals, the SDGs, that was an amazing compact by countries. It was what the countries wanted. So I'm going back again and I'm saying this whole issue of governance in regions, sub-regions, and also global governance has to be rewritten in order to support the changes that this guide is showing us.
It's not going to be easy, right?
No,
Dr.
but it's going to be a challenge. I love the challenge.
That's scary.
I know. So I guess we will start with the launch. Maybe you can tell us about when this guide will be launched and next steps.
Great. Yes, so next Friday at 9:30 Washington, D.C. time, we will have a launch where our Assistant Director, Dr. Yarwas, is going to launch, and we have a panel of distinguished commenters, among which we're very happy to have Dr. Joy again with us. We have somebody from Brazil. We have the Minister of Health of Mexico City. We have somebody from Canada. So it's going to be very, very interesting. It's going to be a discussion, about the reflection, about how to use this, what else is needed, etc. So I would say the next is keeping it on the agenda, making sure that what we learn now continues in time and that we do things differently. So that when there's a next pandemic, hopefully not for a long time, but that we're better prepared, that we're not in a situation like we're in now, where things really have been very hard for a lot of people, and that we are much better prepared, not only with universal health, and I'm very happy that Joy brought that up, which in our region includes the social determinants of health, which I think we do much better than WHO in this case. But that's just an example. There's also the other side that we really need to make sure that we're there, that we're ready, that this cannot happen again, and so I think that's basically for us what we see as the next steps. We cannot rest.
Agreed. Dr. St. John, would you like to give maybe some key takeaways that you'd like to leave with us?
I want people to realize that as drastic and dramatic as life with COVID has become, there are some really wonderful things that have happened because of COVID. First of all, we've had to face and focus on some things in our society that just were not right. And the fact that some people, just because of how they were born, have not had the correct access to many things. So that for me is important. Lisa, I always say the hardest thing is to know. And then the other good thing is that sectors that not normally would speak to each other have started talking seriously. And they've started changing how they do what they do with health as a focus. And the other positive thing for the region of CARICOM has been the demonstration of bravery, the fact that the heads of government took the importance of life and followed the science and didn't politicize it. And although we are having problems with our economy, we have our people who can build us back. So I see COVID as a positive. While I have been struggling with some things, I see it as a positive. And I want people to realize it's a golden opportunity to make a lot of wrong things right.
Yeah, I agree. I think there's definitely an opportunity here, but this is a window of opportunity. This opportunity is not going to be there very long. So I think, and we know that after crisis, during the crisis, everybody says, oh, we have to think different. We have to have a better new normal. And there's a lot of ideas about how that should happen. But I think it's really important that we are concrete and that we really make it happen, because there's also the risk that we go back to the old normal, only with more inequalities and more exclusion and more people who have fallen out of the systems. So I think I totally agree that there is an opportunity, but we need to take it and we need to build together and use that solidarity, use that, the good that has come out in people, the intersectoriality, the collaboration, and use that to galvanize that change that is needed. But we cannot just expect the change
to happen on its own. Agreed. I think we still, despite the fact that this is, it was a very complex topic, a very interesting topic, because like Dr. St. John, Dr. Joy, as I like to call her, I love to talk about the determinants of health because it pushes you to think a little bit broader, So thank you so much for joining us today. We hope that you learned something. We hope you will join them for the official launch. That will be happening on the 11th, yes?
Yes.
At 10:30? 9:30 Washington time, 10:30 for the Caribbean. That's right. And we want you to remember that vulnerability is important, and vulnerability has changed. And it includes topics like exclusion and inequities, but we can learn from our mistakes, we hope, so that we can be better if we have to go through something like this again. And to remember that we're not just talking about a strong public health system, but rethinking our social protection system so as to be more inclusive. So we hope that you learned something today. Thank you so much for joining us, Dr. St. John from the Caribbean Public Health Agency, and Dr. Jerry Akemans for helping to bring this wonderful guide to us. And we hope that it will be widely shared. We look out for that launch coming up just next week. So thank you so much for joining me and talking with me today, and to everyone who joined us on Facebook and Twitter. Have a wonderful evening, and we'll talk to you later. Thanks for joining, and bye-bye.
Have a great weekend, Lisa.
Bye-bye.
Have a great weekend, Jerry.
Thank you. Bye.
Bye-bye. Thank God it's Friday.